Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, defeating D problems of defeat will help keep you on your toes. Then, if you know a senior who's home alone, we'll share tips for keeping them safe. Are your teeth troublesome? We'll tell you how to declare your independence from dental difficulties. Plus, we'll go behind the headlines of Cleveland history with a groundbreaking journalist. And how Ohio law discriminates against seniors who suffer injuries.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Do you feel like a heel for the way you treat your feet? Dr. Angela Grady is here with tips to keep your toes on top. Dr. Grady is a podiatrist with Metro Health.
Hi, Lori.
Welcome, welcome, welcome.
Thanks for having me.
So tell us how our feet fare as we age.
So as we age, there's a lot of things that we see. One of the major complaints that people have is that their toenails change. And this can become a real problem. The toenails can become thick, they can become yellow, they become discolored, they become crumbly. And what that causes, it can cause having a very difficult time trimming the toenails by yourself. You find that the clippers just don't cut through the nail anymore.
Is that simply because of aging?
No, it's not all aging. It's aging and it's also a fungal infection. Everyone sees those commercials with the little guy running around. The fungus takes up in your nail bed and then it produces that nail that doesn't look normal anymore. And it's, people are embarrassed about it, but it's very common. There are studies that show about 90% of people over 70 will at some point have an issue with the toenail fungus.
Wow, wow, wow. So what is causing the fungus then?
It's the fungal spores. They implant into the skin and then they cause
Is it from wet feet?
It can become from wet feet. That's one of the big things. Fungus like dark, warm, damp spaces.
Like inside shoes.
And that pretty much is inside shoes. So that's one thing that can cause it. So
okay. So if we're trying to avoid this situation,
yes, there's
getting
lots
older,
of things we can do to try to keep our feet dry. One thing is I tell patients to avoid soaking your feet. A lot of people like to soak their feet, but it keeps them wet and damp. Also, after bathing, to dry very well between your toes. That helps. Changing socks. Sometimes people wear the same socks a couple days in a row. When they get damp, that doesn't help. Also, drying between your toes. You can change your shoes every day. Even put a spray of Lysol in them once a day. And if you're going to be in public pools or locker rooms, showers, it's a good thing to wear a sandal on your foot so that you're not picking anything up that you don't want.
Yeah, that's a kind of a scary thought that you're walking through all kinds of nasties on the floor.
Exactly.
Kind of like when you touch things, your feet are going to pick it up the same way your hands do.
Exactly, and you're constantly washing your hands, but you don't think you're not constantly washing your feet, so it makes a difference.
So soaking your feet is not so good, but washing them and drying them really well would be a good thing?
Yes, drying well between your toes is absolutely necessary.
Okay. So in addition to having issues like this, do our feet change shape or size or anything as we age?
They don't really tend to change size. However, you can have deformities of your toes. They're called hammer toes or bunions, where the bones can develop arthritis and become more prominent. And then once they're more prominent, you notice that they might rub in your shoe gear, and you can develop corns or calluses on that area or even a wound.
Ooh. So our inserts into your feet. Oh, that's hammer
Those
toe?
are hammer toes. So you can see towards the tip of the toe, there's kind of that area that looks a little red and enlarged. And then you have to think, once that's in your shoe, if you have a very narrow, tight-fitting shoe, that's going to rub and get irritated and can cause a lot of pain and a lot of problems.
So those really stylish shoes that all the women should be wearing with the pointy toes and real high heels, not good, huh?
No, I don't normally recommend those.
And you also say for diabetics that they should pay particular attention to their feet. Why is that?
Yes, absolutely. Diabetics are more prone to have foot problems. They're also more prone to having infections in their feet. And also, they can develop peripheral neuropathy, which is a decrease in sensation in their feet.
Ooh, what can that cause?
So the combination of the decreased sensation, any deformities, and more prone to infection, you can develop wounds that can get infected. So what I normally recommend for diabetics is they want to wear shoes that have a higher, wider toe box, so it's a little bit more roomy, so there's not as much rubbing going on, and that tends to alleviate a lot of the problems.
All right. Wow, well, this has been very great information for us. So if you toe the line and follow Dr. Grady's tips, you don't have to get defeated by your feet. Need more footnotes? Use the information that's coming up next.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, safe at home. But first, make my day. The delivery of that line showed Clint Eastwood was perfectly cast as Dirty Harry Callahan in the many movies where the actor portrayed this police officer. But several cinema stars rejected the role before Clint clinched it. Do you feel lucky? Then name any of the 3 box office breadwinners who passed on this part. We'll audition your answers when we return.
My husband and I got into the car and we couldn't do it. We couldn't pick one baby over the other. Coming to Metro changed the entire pregnancy. We actually started to become happy with our situation. We owe a big thank you to Metro. I can't imagine our family without Sam.
The Duke, Old Blue Eyes, and Butch Cassidy kept clean away from playing Dirty Harry Callahan. John Wayne, Frank Sinatra, and Paul Newman all said no thanks to dirtying their images with this cop role. Enter Clint Eastwood, who said yes and then made 5 films acting as that inspector.
We love our home sweet homes, but are they home safe homes? The fact is, as we age, our domiciles can become dangerous. Nurse Karen Wolf is here to identify spaces in our places that need to be adjusted as we age. Karen is a co-owner of a local Home Instead senior care office. Welcome to the show.
Thank you for having me.
So there are hazards in all of our households, right?
Yes, there is. Yes. Unfortunately, we see that 85% of seniors haven't done anything to avoid having these hazards in their home. So what I'd like to do is go through some of the different rooms and talk about some of the things we can do to try to make them safer.
Okay, that sounds great. So where do we start?
Well, we're going to start with the bathroom. ER physicians have identified that as the place where most accidents happen. Falls is the typical one that they usually see.
It's a hard floor in there typically too.
It is, and then we've got water, which makes it slippery, definitely. So the first thing that I want to talk about are the towel racks. I see a lot of the times that seniors want to grab the towel racks, and those are really not attached to the wall properly.
Right.
They can really just rip right off. So installing appropriate grab bars by the shower and the toilet are definitely going to be a lot safer. Also taking into consideration height of things and making them in things that are easy to grab, and then also even just like the toilets can be very low. So having the toilet seat insert that raises up the toilet can make it a lot easier and safer for our seniors. And then the other thing would be the water that is slipping.
Yeah.
So have a rubber mat in the tub to make it less.
How about one of those benches so that you don't end up getting so deep down you can't get out?
Exactly. A bench is a great idea, and that's a huge recommendation for our seniors. So.
Okay, so bathroom. Now we're going to move into the kitchen. So what can we do in that room?
Well, again, it's about height, a lot of it, and just making things within reach. If it's too high or too low, that can be dangerous. So even if attaching hooks on the walls, so the pots and pans that are used more often, then they can grab those easily, or utensils. Keeping things off the counter so that's clutter-free. I see a lot of times people navigating on the counter with their hands. If there's a lot of things on there, they could slip and fall as well. And then don't forget about the food, because a lot of times it gets spoiled or is expired, and that should be almost a weekly thing, going through and discarding things so that they are not eaten, so that the individual doesn't get sick.
Or leaving it in the microwave and thinking it's okay after a few hours.
Yes.
That would be a big problem too.
Yeah.
And now how about the bedroom? How can we make sure the bedroom is full of sweet dreams and not nightmares?
Well, first off, a lot of times the bedroom is on the second floor or downstairs. Keep in mind the stairwell. It should have a handrail the whole entire way and be well lit the entire length of the stairwell. Then once you're in the bedroom, make sure that everything is clutter-free again, that the senior can navigate through the room easily, and that might be getting rid of stuff, even getting rid of some furniture so that they can get around easily. And then the other thing would be at night, making sure that there's some sort of lighting if it's a night light so that they can get to the bathroom easily.
Yeah, and decluttering, I would imagine that also includes running cords away and behind things, not across the floor like I see sometimes in people's houses.
Yes, absolutely. So yeah, get those out of the way because that's a definite trip hazard.
Oh, definitely.
And we, you know, not only it's the ambulation, but it's also, you know, with walkers and things that it can get really dangerous.
Okay, well, thank you so much. Now, I know what you're thinking. What about the living room, the garage, the basement? Isn't there more room for improvement in these spaces too? Yes, but we've run out of our room. I mean, our time. So for a complete home safety checklist, use the information that's coming up next. My thanks to Karen Wolf for helping us to put safety first.
Thank you.
For more information, call Home Instead Senior Care at 1-800-640-3914 or log on to www.makingHomeSafeForSeniors.com. Next, celebrate the freedom to smile. Looking for places to go, things to do? Welcome to our community calendar. What's the buzz? A sweet event where you can take your honey to get some honey. The July Honey Fest takes place Saturday, July 12th from 11 a.m. to 5 p.m. in Homestead Falls. Presented by the Grand Pacific Junction Merchants Association, you'll be happy to know they pour out information and demonstrations. To gather more information, give them a buzz at 440-235-9277 or let your fingertips fly to www.gpjmerchants.com.
We just celebrated the 4th of July, but maybe you don't feel like you have the freedom to smile. Today, dentist Steve Marsh will help you declare your independence from troubles with your teeth and discover a smile that just might set off fireworks.
Hi, Lori. Thanks for having me.
Steve. So, a couple of weeks ago, you talked about dental dilemmas at different decades, different ages and things. But I mean, really, no matter what the age is, people want to be happy with their smile.
Yeah, and I can't tell you how many people I sit across the table when I first meet them, and I ask them, my first question is, why are you here? What's bothering you? Before we put them in a dental chair, because I want to know the person. And I can't tell you how often people will say to me, when photos are taken now at weddings and functions, I don't want to smile. People now have iPhones, so they're taking pictures all the time, and they're very uncomfortable with that. We have people working longer, and they go into the workforce. They want to have a better smile as we mature, get older. So today, more than ever, it's important. I had a woman who came to me in January. Her daughter's wedding was in May. She hadn't been to the dentist in 10 years.
Oh, my goodness.
And it literally took about 4 months with a combination of implants and partials and crowns to bring her back, and we finished about a week before the wedding.
Just in time.
And she said she had a great time.
Oh, good. So you do have some solutions, though, for our viewers' issues, and I guess we're starting with implants.
With implants, and I mentioned that with implants, and I think we'll just show a lot of pictures because I think that's the best way to show what's going on. So this is somebody I'd actually reconstructed his mouth. We used some crowns and veneers. He also had a tooth that had a root canal, and the root canal tooth actually fractured. They become very brittle over time. We knew it was a chance. The before picture, you can see what's called a healing post. The implant goes in 4 months later, you're able to restore it, and now you can see with the implant post and crown in, you can't tell which tooth was missing before. So that's a single use of an implant. You talked about people in different stages of their life. So this is a gentleman, mid-70s. He's dating again. He wore a partial. He was missing lots of teeth. His girlfriend brought him in. She had been a patient for many years. What you're looking at in the before, looking up into the patient's mouth, those are actually what we call implant abutments. They had been put in about 4 months ago. We then put these coverings. You see the white? We used a few of his teeth and then gave him individual crowns on each tooth. That enables him to not only eat well and function well and look better, he can now floss between each of them. And so that was a wonderful use of implants, but again, many implants there.
How about partials?
Okay, so we talked about the man whose girlfriend didn't want him in a partial anymore, and he was unhappy, and he said, I have other patients who say, what can we do with partials? And today we can do them non-metal, and they look fabulous, and we have some pictures of that. This is a patient who came to me. He had worn one of those old partials with metal hooks and clasps. They torqued the teeth. They didn't do very well, so we made them a Flexite type partial. Again, Lori, if you look, you can't see any metal. There isn't any. He loved it. It looks good, and he said it's so much more comfortable than my old metal partial.
And you mentioned crowns already, but you've got some extra pictures, huh?
Yeah, and this is a story about a young lady who was in her 20s. This is not one of our maybe regular Golden Opportunity viewers. Obviously, she's somebody's daughter and granddaughter. She had had white calcifications, and her dentist put bonding over it, and he wasn't happy with it, and the patient really wasn't happy. She's young. She wants to become a model. So he, in his judgment, actually sent her to me. We took off the bonding. We did some gum contouring and porcelain veneers, some crowns in the back to give her that smile. And here's a woman, a grandmother, who was at a party. Her friends were smiling. She was ashamed to show her teeth, and she said to them, by the way, I love your teeth, and the patient referred him, was a patient of mine. And she had also mentioned to me that her grandkids had said, Grandma, your teeth don't look so good.
Oh,
so
dear.
That was really, for me, gratifying that she chose us, but also she was pleased with it. She said, I go to a lot of dinner party, actually, which people don't have very much.
No, not anymore.
But she was at one, and also the fact that her grandkids, that really bothered us. So we were able to do porcelain veneers to give her that smile.
Excellent, excellent, as always.
Thanks.
Don't let the tyranny of troubled teeth rule your smile. Go forth and free your teeth to grin again. For help, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, taking stories from newsprint to videotape. It's time to get up and go, an exercise minute on Golden Opportunities.
Hello everybody, it's Mike Harbin from Breakout Fitness, and today we're here to show you how to work the shoulder muscles, but more importantly than the shoulder muscles, the trap muscles, which aid our neck in moving all different directions when we're driving or even sitting at the ballpark watching a game. You ready to go? I don't know. Exactly, you already got it. What we're going to do here is we're going to stand on the center of the band. Okay, we want to make sure there's a nice amount of tension between our foot and our hand. All we're going to do is maintain good posture, make sure you breathe, but we're going to bring the shoulders to our ears and then back down. Your arms should stay straight throughout the whole movement. Just squeeze your neck and look forward, okay? Raise your shoulders as high as you can, as if you're saying, I don't know.
I don't know.
How you feeling?
I don't know.
I don't know. All right. All right, we're looking for 12 to 15 repetitions here, at least 3 to 4 sets, everybody. And now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
As a Cleveland reporter, Doris O'Donnell saw and wrote about it all. The dark side, crime, murder, riots, and the light side, riding an elephant, following the Indians, playing Santa Claus. Thankfully, she never stopped writing, and she reveals the real story behind Cleveland's hot history headlines in her book, Front Page Girl, and in a DVD series produced by Mark Wade Stone called Doris O'Donnell's Cleveland. Mark is a media producer and editor for StoryWorks.tv, and he and Doris are here to tell all about it. All right, we're so happy to have you here.
Thank you very much for inviting us.
Doris, your career spanned nearly 60 years, so how are you able to choose which stories you're going to put in your memoir?
Well, you try to put in as much as you want to. When I started writing the book, I wrote 350,000 words.
Oh my goodness.
And it got down to 22 chapters, so, you know.
Okay.
But the editor found a lot of, you know, like the Shepard case, the big cases that were fascinating. And
Especially Shepard, I mean, that was right here.
That's
so,
right.
And the Huff Riots.
Huff Riots, yeah.
That was all here in town.
That's
but
right.
I also,
Yeah.
Chappaquiddick and the
everything.
Kennedy assassinations and Martin Luther King, all of those things were huge topics that hit the headlines
that's
everywhere.
right, yeah.
So, and you like crime and politics, really?
Well, they always seem to be related.
That's probably true.
You can't go very far, even to our current politics all over the country. No, but the people involved in those things are probably the most interesting. And I always thought that Chandler Burns, one of our elevated crooks and whatever, if he had not gone crooked, he would have been like the head of a big corporation. Because he was a fascinating guy. But he liked the more exciting, even the kind of bloody excitement.
Oh dear. So, And in the books, you're able to not just report the story, but talk a little bit of the story behind the story. And it's all good reading. Like in the book, you say you thought Sam Shepard was really guilty.
Yes, I did. Well, you know, I was on that case almost from the beginning, but before the murder, the people on newspapers got to know the Shepard family because there was the Plain Dealer in the morning, the news in the afternoon, but they played the press. So the Shepard brothers would take turns calling the press, news, and Plain Dealer about their exploits at the hospital.
Oh, my goodness.
And one afternoon, I got a call from Dr. Sam Shepard. And this was for our 3 o'clock edition, because we had 3 editions, you know, 9, 12, and 3. And he went on to explain how he sewed this woman back together. She'd been in a terrible automobile accident, on and on. And of course, that made the headlines. And not knowing that this was going to be one of the women that he courted, and he even admitted after she had braces on that he was having a sexual relation with her in Rocky River Park.
Oh my goodness, yeah. All that backstory. A lot of people didn't know what was actually going on.
There were lots of things.
And you couldn't report it either.
No, we couldn't report it. No.
You just knew all this stuff.
You'd go back and say, I have this and this and this, and they'd say, well, we'll talk to our lawyer.
Oh, boy. Okay, so, Mark, we know Doris's stories make for great reading. What made you think that they would make great watching as well?
Well, just listen to her. I mean, she is what you would call institutional memory of this town and of journalism in this town. She knows where all the bodies are buried, maybe even literally.
Are you telling us?
But it
not on this show.
And we have tape of things that we really couldn't put in the shows either. But she just has a knowledge of everything about this town. And I knew when I first picked up the book that it wasn't going to be just one documentary, it was going to be a series.
Okay. So you've got 20 or 30-minute episodes, a number of them already taped. How did you decide what exactly you were going to put into the DVD?
Very tough. I probably went through the same problems that the Kent State press editors went through. But I first of all had to go for the Shepard case for the first,
of course,
for the first episode, which won us an Emmy. Actually.
Oh, excellent! Congratulations.
And yes, you tend to go to the more salacious stories, maybe, but not really. We ended up really the focus of it is journalism and how journalism covered in those days these kinds of cases. It's different nowadays.
Yeah, it's much different now. So I'm glad it's being documented by the two of you. So there are so many stories and so little time. However, thanks to Doris O'Donnell and Mark Wade Stone, you can read all about it or see all about it by using the information that's coming up next. My thanks to Doris and Mark for joining us today.
Thank you.
Gosh, see.
To purchase Doris O'Donnell's book, call the Kent State University Press at 330-672-7913 or click to www.kentstateuniversitypress.com. To find out more about the video series, call Storyworks TV at 216-228-1441 or log on to www.storyworks.tv. Next, how Ohio law discriminates